Hi, and welcome to this week's In Focus on Whitewater Community Television's WGTV Channel 11. Thank you very much for spending a little bit of your time with me as we continue with our social distancing In Focus programs. Eventually, maybe we'll get back to doing them in the studio, but I think my next guest will tell us maybe when we have a chance to begin to do some of that. We'll talk a little bit of social distancing and what we have coming up and what we may or may not see as normal as we talk with Christine Stinson, Executive Director of the Wayne County Health Department. Christine, thanks for being back with us again.
Eric, thank you very much for having me.
Always. Let's go ahead and get a couple of things off the plate real fast. COVID-19 obviously continues to be probably the thing that's happening most in your world. As we talk on Monday, where do we stand coming off the weekend? What are we seeing?
We're seeing a general plateau of our numbers. They're just hanging very steady. We're not seeing a decrease, but that's okay. We've really increased our amount of testing. One of the other things that we are watching closely is working with Reed Health and looking at what are we seeing coming into the respiratory clinic and what do we see being admitted to the hospital, how many ICU beds are being taken up, how many people do we have on ventilators. Those are some numbers that we more closely are watching and putting stock in as far as real big red flags going up. So in Wayne County, roughly, we're seeing about 3 laboratory confirmed cases a day. That seems to be our sweet spot right now.
Okay. More people are taking advantage of the site since it has moved to what we know as the former Elder Beerman building. It started at the Armory, really wasn't getting much use, got moved. People are getting used to it and people are getting the message that it's open to the community, doesn't really cost them any money, and that everybody is being encouraged to get tested. Everybody.
And also now they have opened it up that you can be retested. As long as you're 48 hours in between tests, keep that same patient ID that you get the first time that you go, and you can be retested every 48 hours. I had actually one of your counterparts call me today and say, do you think I should be retested? I tested about a month ago. You guys are out and about in the community doing interviews. Absolutely. I think that we all should. I am going to go be retested tomorrow and know my status because I was tested in May. I think that it's time. I'm very cautious about my interactions because I do have a staff that I want all of us to be able to maintain working. So I very much limit where I go and when I'm in groups of people that I don't know their status. So I know my family's status, you know. So,
sure.
But I should be retested. And so I'm going to go tomorrow. They also have changed. I got some phone calls from people concerned that they weren't doing the right test because when they started, they were doing that posterior nasal pharyngeal test. And now they're doing the anterior. So it's a much more shallow swabbing of your nostril. A lot more comfortable. They are doing it correctly, and they're doing the frontal swab because the CDC has okayed them to do that, and it is a much more comfortable swab. The testing rates, as far as reliability, are exactly the same. So why go really deep if you can accomplish the exact same thing doing the frontal nasopharyngeal space?
Telling them that may get some people to actually go and take the test because I know a lot of people, myself included, were very concerned about somebody sticking that Q-tip to, you know, as some people said, up in our brains.
It wasn't the first one I did was deep. Like I said, it wasn't something I wanted to do every morning, but it definitely was. I tolerated it well. I came back to my office and gave myself some candy to reward myself for not crying, but it really wasn't that bad. But now there's no excuse. It's the frontal swab of the nose, and you'll be in and out very, very quickly. So depending on where you live, if you allot 15 minutes for the test, you're going to be in and out of there with plenty of time.
We've got a number of people who may be watching this because they're in the county right now. Remind us of what the rules are. Someone who lives in Ohio, works in Wayne County, and we have a number of people that cross state lines. What are the rules for people who can walk in and or call in or whatever and use this facility?
Right. This is a Optum site, so it's in coordination with the Indiana State Department of Health. These rules are from ISDH. They funded it, but because it's funded through Indiana tax dollars, it's for Indiana residents only. I wish that I could change that. I really, really do. I wish that I could say, no, I agree. You're working here in Wayne County. I want to know what your status is as well, but I have nothing to do. I can't waive that. You do have to show an ID. I wish I could waive that too. So there are things that if I was queen for a day would be changed, but you do have to show an ID and you do have to be an Indiana resident.
Okay. You're watching In Focus on Whitewater Community Television's WGTV Channel 11. We're taking some time and talking with Christine Stinson, Executive Director of the Wayne County Health Department. Have you gotten used to that title? And I'm not being facetious. You've been in place for 5 months, maybe. I think it was January. You came in.
February 2nd or February 3rd was my first day. February, March, April, May, 4.5 months.
Okay. So you've come in, you came in at a time where, you just kind of hit the ground. This thing was in your face.
Yeah.
On top of that, you were told you had to move the facility. You got a lot of things thrown at you. So let's talk about your transition a little bit to this.
Yeah. Well, I came here from Marshall County. So if you ever hear me answer the phone and say Marshall County Health Department and then quickly change to Wayne County Health Department, I have done that a couple of times. So that does kind of take some rewiring of the brain. And there has been a lot going on. Like you said, we moved. So after just a month here, we moved to the new location, which is at 100 South 5th Street, right here on the corner of South 5th and A Street. So when I look out the window, I can see the Fire Station 1, and then to the north of me, I see the Annex building. So we're in a very, very well-traveled and visible location. We have some new signage on the building, so hopefully people know where we're at, and we'll be able to utilize us when we do open back up to the public. And I can talk about our reopening plans.
Yeah, I was going to say, what is the time frame on that, and what can people get from you right now? I know one of the things when we talked previously that you were really trying to get up and moving so that people could use was the vital records area.
Yeah.
I assume that was the start, and how is that being handled even to begin with?
Right now, everything is through the mail. So we have the birth and death applications on some new mailboxes that we attach to the building. So you can pick those up and you can mail those back in, and then we mail them back. We are going to open up starting on the 16th, where you can make an appointment at the health department and come in. So if you need those right away and you can't do that, we're going to start doing appointments where people can come in. You will be asked to wear a mask. If you don't have one, we'll provide you with one. But for the safety of our staff and yourself, both will have masks on. Our employees, when we're in our individual office, we don't have to have a mask on. But when we're in the public communal spaces of the health department, the staff will be wearing masks as well. And that's to keep everybody, our risk of transmission down. And we know that if both parties wear the mask, we can greatly reduce transmission of COVID-19.
Talk a little bit about your staff. Some people who were with the health department obviously came over with you. Some people, some familiar faces that people may know from the clinic side that, they were kind of all one for a lot of people, stayed with the clinic. So let's go through some of your areas. We talked about vital records just a little bit. The other thing that people probably know most from the health department is the food inspection area. That got done, and those got published in the Palladium item every month or every couple of weeks. How often is that even done, and who's it getting done by?
Well, in Wayne County, we have a food ordinance, and when you're with the county, you do everything, by statute and by ordinance. So our food inspectors are in the restaurants 4 times a year. 2 of those are for inspection, and 2 are just general site visitations to where they just are staying in contact with them, making sure that on a cursory view, things are okay. If they have any, it's more of a goodwill tour that they do to stop in and just make sure that everything is going okay. So 4 times a year, our health department is in the establishments in Wayne County, and those are retail food establishments. So think about your grocery stores, gas stations, and restaurants. Those are the establishments that we go in and inspect 4 times a year.
The type of things that you are looking for, what are those when they go in and do that?
Well, probably the most visible one to the public is cleanliness. And that's one of the things that we do. And if you're not going to keep it clean for the customers to see, the chances are of you having it clean back behind closed doors where the customers don't see, it's a pretty good chance that is even worse than what the customers see. So general cleanliness, and then also temperatures. So we look at temperatures of the holding units. So think about reach-in refrigerators or walk-in refrigeration and freezers, and then hot holding and cold holding temperatures. So on people that are familiar with restaurants, they're called make tables and steam tables. We take temperatures of all of that, make sure that they're in the hot and cold holding temperature zones. And if not, we help them troubleshoot to find out why. Is it poor practices that they're doing, or do they have a problem with the unit itself, unable to hold the food at the proper temperatures?
Something I've always wondered and truly never asked, since they know you're coming in 4 times a year, is there a schedule? Like they know, okay, they were here 3 months ago, they're going to be back. One would think that no one would fail in an instance like that because they know you're coming right around this time, right?
Well, I think that's why Wayne County made it 4 times a year, because the chances are better keep it clean. They're going to be stopping in once a quarter. So that's great. But no, we do not announce our visits, and most of the staff, and I know that's been this way even back in the day when I was a food inspector, I didn't even know where I was going. The morning I'd get in there, you kind of feel like, do I want to do a big one? Because when you get into places that take raw food and cook it and then hold that food and then cool it down and then reheat it, that's a complex process that it has to go through. And there's lots of critical steps in that. And so those kind of inspections take a lot longer than, say, a gas station that has soda pop, coffee, and hot dogs on the rollers. Those are pretty quick inspections, and you can get a couple of those done in the time that you would do like a major restaurant.
Talk about a little bit about how your office handles lead. Wayne County, I know obviously parts of Richmond have some older housing stock. Is lead still an issue, and what are you all doing in those areas?
Yeah, lead is something that I'm starting to wrap my brain around as we've kind of went COVID response since I've been here, and now we're starting to look around at okay, we got to get back to a new normal. How did we handle lead in the past? What are our testing rates in Wayne County, and what can we do to improve those? So we have bought some new equipment, and when the way that you used to do a lead test for a child to get their blood lead level was you would prick the finger and then you would squeeze the finger and drip 5 drips onto a card, and that card would get mailed to ISDH laboratories. And then you would get the test results back, and then we would call that family and talk about the blood lead level. There are some awesome lead analyzers, and this will be a capillary stick. So a minor prick of the child's finger will take a capillary draw and put it in the analyzer, and in 3 minutes we'll know that child's blood lead level. So with the child right there, we'll be able to discuss in real time the risk of having an elevated blood lead level. There's different levels. 5 is an action level, a 10 is an action level, and all the way up to 50, which requires then medical intervention. And it's a chelation treatment where then we try to draw the lead out of the blood. So we definitely don't want anyone going into chelation. So if we can catch these blood lead levels at 5 and we mitigate any future risk to that child, we can eliminate a lot of long-term consequences to lead exposure. So those will be things that will be offered when our clinics open back up.
Your health educator, I'm trying to get through some of the people that will really contact with the community, that they'll need to see, that they'll need to know. Talk a little bit about that area, what you see doing that maybe is not being done or hasn't been done, or that you just want to do differently here in Wayne County. So talk about that position, the health educator.
Yeah, that was something when I came in and kind of did a quick look around of roles and responsibilities. I didn't see anyone that was totally focused on the health education aspect of your public health department. And one of the employees, Angela Mcdaniel, was just a natural fit to that. She really enjoys that, and I want people to enjoy what they're doing. And so she's been taking over the health education aspect of it. And what that looks like, oh man, if I had a crystal ball to look at what are we going to be looking at, because usually you're doing health fairs, you're at the farmer's market doing different things. And right now, we're not going to be doing anything like that. So we've done a lot of our focus with the health education on our social media aspect of that, and kind of her doing outreach with different organizations and things like that, and making sure they understand some of the requirements and the guidelines that the health department has put out as far as COVID-19 is going. She's my go-between with the Optum site and the health department. She's the one that facilitated getting all of the signs hung up, so we had a much more visible testing site here at the old Elder Bierman site than we did at the Armory.
How do you think in your mind that grows? Is she potentially in and out of schools? Is she educating restaurants, or is it more of a education of the community as to what public health does, and some of the things that we as individuals need to watch out for in our day in, day out lives?
Yeah, a community health educator can do all of those things. Right now, she still has part-time food inspection duties to do, and then she is part-time health education. So as we move forward and as that position grows, I firmly believe that a community of our size should have a dedicated full-time health educator. So they are available to go into schools. They are available to go into Earlham and talk with the future health educators of the world. And but then to also do CPR classes and some more individual public education that we want the community to have. We do have a Narcan program now that anyone in the community that wants or feels like they should carry Narcan, they can come to the health department, be educated on how to use that, and they'll walk away with a Narcan kit to use. Those are things that are community-based, but very individual also.
You're watching In Focus on Whitewater Community Television's WGTV Channel 11. We're spending some time with Christine Stinson, the Executive Director of the Wayne County Health Department. Nursing. When the health department is attached to the clinic, the nursing portion of it seems pretty natural.
Yeah.
With that separation, talk about what the nursing division or department of the health department
Right.
like responds to how it interacts with the community.
So yeah, public health nursing, kind of the pillar of public health nursing is immunizations. And how do we ensure that the Wayne County community has high immunization rates? And that's doing outreach clinics, that's going to areas that have low immunization rates. So you might start seeing the health department have mobile units going out and not expecting everyone to come to us, that we'll meet you where you might need. So you may see clinics popping up where we're in maybe Cambridge City one day a month. We may be in Fountain City one day a month. And then always we'll have clinic times here. But childhood immunizations, that of course is going to be offered. We'll also have some adult immunization programs that will be run through the health department. So Tdap and hepatitis A and B, those kind of shots for adults will be available. Outside of those things, we also do, like I said, the lead testing. And then we also have our HIV, hepatitis C, and STD clinics that are also ran out of the nursing division. And there is a big need in Wayne County to have those services. Unfortunately, we have some very high distinctions in the state for high rates of transmission in hepatitis A, B, C, and also syphilis. That's still going on. We're still battling that. That division of the nursing is open and taking appointments, and we are still meeting the needs of that. And that's important for people to know, that they can still get those services even though the health department's closed. We are combating this. Right now we have the most syphilis in the state in Wayne County. So we're really trying to get rid of that distinction.
How do you and your office work on that? How do you bring those rates down in this community? What will it take? What is the conversation? How do you see your staff and your department mobilizing to fight that?
Yeah, we're working with the state with that. They have some disease intervention specialists that kind of are easier to work out and amongst the clinic or out amongst the community, easier than we can. But we try to meet people where they're at. And if, the people that run that program, they're out and about, they don't make people come to us. We'll go to them for treatment and testing. And that's important for people to know. It's a very treatable disease, and we will offer the treatment and the testing here at the health department. They can just call our line, and it's a series of, press 2 to talk to the nursing division, press 2 to talk to Chris, who is with the HIV and hepatitis C programs and the syphilis testing. And the phone number for the health department is 765
73
9245. 9245. Thank you. I always forget the 973. So I don't know why I cannot remember that.
You're still adjusting. We talked about that. The high rates that you just spoke about was one of the things that was the driving force behind what became known as the needle exchange program in the county. The commissioners felt that from a public health standpoint, it was something that was needed. The prosecutor doesn't believe that it's something that should be going on because it is somewhat counter to what's written in the law.
Right.
How do you all come to a meeting of the minds so that you all are able to do what you need to do for public health? He's able to do what needs to happen from a law enforcement standpoint. How do those two things marry so that we don't have two branches of Wayne County government kind of butting heads on this one issue?
Yeah, and I don't butt heads. with the prosecutor. Mr. Shipman was incredibly respectful when he voiced his dissension to our desire to have that renewed. And I get it. I totally understand where he comes from. And the easy answer is to change the law. You know, what made needles illegal was it was meant to do that to stop drug use. It didn't work. It didn't work. So if we would take that away and make the needle part of it not a law anymore, where it's illegal to carry those, then Mr. Shipman doesn't have any kind of fight with the health department, because we certainly do not want to see drug use increase. We would love to see it decrease. But the health department's role in this community is to stop the spread of disease. So I stay in my lane and I do what I know works. I don't create, this isn't an idea that I came up with. I look at what works in other communities, and that's what we go with. You know, and needle exchanges, however distasteful they are, work in what they're set up to do. Now, there's some other things that happen outside of a needle exchange. You see the rates of people going into treatments increase also with that. That's not the role of a SSP or a syringe servicing program, but it's a byproduct of it. And so, you know, the more people we can get into treatment, the better the whole community is. You know, but financially and morally and everything else, the more disease we stop from being spread in this community is also a benefit to this community. And when you have a SSP, you know, every time that they come in, they're asked, are you ready for treatment? We meet people where they're at. And if they're ready for treatment, we can get them right into it. But it's where they're at. And if they're not ready for it, it does no good to beat someone over the head and shame them into something. Meet them where they're at. But it's one time a week that they're asked, are you ready? That's one time more a week that they're asked if there is no SSP. It allows us to follow that population and know the true disease status of that population and provide them with treatment and services, not just for them, but for everybody else that is interacts with them. Because, you know, people that use IV drugs, believe it or not, interact with the quote unquote normal people. And so, you know, we're looking at other people also, you know, to help them from getting some of these diseases like HIV and hepatitis C.
The renewal, and please correct me if I'm wrong, the renewal is for a year.
Mm-hmm.
What happens after that point? Do you keep going for a renewal, or there's a sunset on this, I think, within the state? Is that not correct?
Yeah, the sunset, that's why this is for a year, because that sunset is in a year. And we're hoping that the state will either do away with the sunset and not make this a reoccurring, you know, kind of thing that we have to do every 4 or 5 years and just, you know, let that go away, or extend it for another, you know, 5 to 10 years. And then we can go back to, you know, I think in the way the law is written, you have to have it renewed every 2 years.
Talk about what the community, in your mind, should expect from this, and how, as a community, we can know whether this is just another program that continues to be funded and continues to happen, or that it's making a difference, and what should be the time frame that we should expect to see some difference that seems reasonable.
Now, the SSP isn't funded out of the health department's budget. So there are other grants that we've gotten to be able to fund this. And then we have silent partners that pay for all of our syringes. So the actual needle is not bought out of any tax dollars. That's important for the community to know. But there are some very big partners out there that do support this because they know the impact that it has. When Marshall County or when Wayne County started their SSP, they were the fourth leading county in the state with hepatitis C, and now we're the eighth. So, in that amount of time, we are making inroads into this problem. But the SSP didn't cause the disease in your community and the needles in the community. The needles in this community cause this community to need a needle exchange program. And we're very fortunate that we had some elected officials brave enough to make the decision, because it's not a popular thing. No one wants to have a parade and say, yay, we need an SSP. No community wants to need one. I would love it if during my tenure here at Wayne County that I can do away with the SSP. But there'll have to be some benchmarks that are met before I would ever say we don't need it. But I would love for us to reach that point where we don't need it anymore.
You're watching In Focus on Whitewater Community Television's WGTV Channel 11. We're spending some time with Christine Stenson, Executive Director of the Wayne County Health Department. We were talking originally about some of the departments and some of the things that the health department does. And it's funny, we don't think about public health much, but it is very much a part of our lives.
Yes.
What have I missed? Talk a little bit about what the health department is continuing to do, and then we'll take a little bit of time and see if you can rub your crystal ball and see going forward, because that's the one that a lot of people care about. I mean, we do the Ask the Doctors program with Dr. Jetmore, Dr. Huth, and one of the questions is always trying to get them to look forward at what might happen. You may be able to provide us with a little guidance, but talk a little bit more about your department, what I haven't asked you about, who we may have missed that is new or that is different with you. Yeah.
Well, we started out with the vital records, and they're named the vital records because they are vital. Absolutely 100% of people will need a birth certificate, and at some point in a human's life, there will be a need for a death certificate. So if those happen here in Wayne County, my registrars are the ones that record it. So every birth that's happened in Wayne County, no matter where you move in this wide world, you'll always have to come back to Wayne County to get a birth certificate. And same with anyone that expires. If they pass in Wayne County, it doesn't matter where they live, their death record will always be held by the Wayne County Health Department. And a lot of people don't know that, and we'll get calls from people that say, well, I know that his funeral was at Donan Mills. Well, that doesn't mean that they died, and we'll help them. We'll do a little research and we'll find out that, they actually passed away in Delaware County. You have to go to Delaware County to get that death certificate. But so those girls are very, very busy. So there's any kind of correction, and with the Real ID, they have been busy with all kinds of corrections, because for a long time, people said, "Oh, I know I know Ann is spelt with an E on the end, but I never do." Well, now their records don't match, and you have to change something. And so we can make corrections to birth certificates, paternity affidavits. We have to file all of those. Home births, we have to register any home births. So very, very busy in the vital records. And then probably our next most visible division is the food division out there. Everybody has to eat too, and even visitors in Wayne County. So I always advocate for a robust and competent food division, and you have that here in Wayne County. There are 5 people that do food inspections in Wayne County. They all wear other hats other than just food. For example, Craig Markley, he's been with the health department the longest. He does food inspections, but he also does vector control. And so people, when they call in, we're starting to get into that season, the mosquito season. That's not going to die down with COVID-19. So we'll have an increase of calls of standing water and stagnant pools and things like that Craig will respond to. And then Jason Howard, who has also been with the health department quite a long time, does food, but he also does public swimming pools. And we know that we're going to be down in the amount of public swimming pools that we have. But it's not just public swimming pools, so not just your city pools. They're also semi-public swimming pools. So any pool that is with a homeowners association or a hotel, we do those inspections too. And then Angela Mcdaniel, she's worked in a lot of different divisions within the county, but with the health department for about 5 years doing food inspections. She also does CPR training, and she's the one that we have put into that health educator position. And then we have Dan Burke that people are getting to know because he has been heading up our emergency preparedness division. So he is the one that's coordinating all of the PPE that comes into us. He's making sure that our plans are in place for when we have some mass inoculation clinics, and we're starting to decide where those are going to be because we know that that's going to happen soon. And then probably one of the quietest divisions that we have is the septic program, or the on-site sewage system. And we have one fellow there that quietly just takes care of all that stuff that has to do there. So if you are not living in a city where you get a sewer bill, you probably have a septic system. And it's really, really important that you maintain and take care of that septic system, that you have it pumped regularly. And if you need to have a repair or a replacement, or if you're building a new house, you'll see Todd Smith, and he will work with your contractor to get the right system in the right place in your on your property.
Busy. One thing I want to ask you about, and you mentioned it, and you've mentioned it a couple of times during this conversation, CPR training. In the days of COVID-19, what does CPR training begin to look like? That's very much close contact.
That's very close contact. And that's kind of far down on my list of things that I'm looking at as far as what we need to get up and going again, because it is very close contact. I would suspect that we will be way more promoting barrier methods and things like that when we're doing CPR. Those are things that we've always talked about because of other disease transmissions that can happen during CPR. But I think that you'll start seeing a more of a requirement to heavily train on using barrier methods when you're doing that. But there will be risk, and there always has been risk when you do CPR on someone. We just try to minimize those risks.
Talk a little bit about, from a public health standpoint, where we go for this summer. We've already seen the protests that are out there, people fearing that within a couple of weeks, some areas will see spikes. Now, we've had a couple of, obviously, we're not New York, LA, so we don't have, 100,000 people gathering. But for us, 500, 600 people gathering is a large number. People are getting back out. Even during our election coverage, Commissioner Paus talked about being out, just kind of doing some informal checking, not seeing a lot of people wearing masks. What do you, as the public health professional, want to say to the community? And Dr. Huth showed that graphic on Meet the Doctors or Talk with the Docs on Friday that showed how you reduce transmission when both parties are wearing a mask. The more that we can understand the importance of wearing masks, and the more that we wear them, the better off our community is going to be as a whole. Because there are some people that you don't want to put a mask on, small children, under the age of 2, and some people that have some compromised lung capacity might not be the best people to have a mask on. But again, kind of like with that herd immunity situation, the more of us around the most vulnerable
in our population that are wearing the mask, the better off as a whole we move forward. And it's been confusing to me. I don't understand the resistance to wearing a mask. I don't remember big protests and people screaming at places that have no shirt, no shoes, no surface, on their door. But if you ask someone to put a mask on, the reason that we've made people wear shoes when they go into public isn't because we didn't like to look at people's feet. It's because there's a lot of diseases that are carried on people's feet. There's athlete's foot, there's warts and all of this stuff that if we all walked around without shoes on, we would have a lot of foot fungus and issues and warts all over our feet. But we wouldn't be put on a ventilator and be gasping for air. But we were fine to put shoes on. But it's a bridge too far to ask someone to put a mask on. And I think we all need to cool down a minute and realize the mask wearing is not a political issue. It's a public health issue, and we know that it works. And the more we can get used to it through this period, the better off we're even going to be as we go into the flu season, because we're in June right now. We're gearing up for the annual flu season right now. And so if we can get into this, then the better we're going to be with schools opening back up, and we'll be able to have more freedoms and be able to not be so restrictive with some of the movements around. But I'm a big proponent of the mask, and I've got one here. I've got several in my car. I have a mask at arm's length at all times. So I hope that that's one thing that we see change through the summer, because I think as we go into the fall, the better our community does at wearing those, the better we're all going to fare.
All right. Christine Stenson, Executive Director of the Wayne County Health Department. I greatly appreciate the time. We will have you back.
I appreciate that.
I'm sure that there are more conversations that we can have, particularly about public health.
Yes. Yeah. I'd love to talk to you again when I have the exact date of when we're going to start opening back up. We are starting to take appointments for our immunization clinic. So, Garrick, if you give them the phone number, I know it's area code 765-973-9245. Call and make an appointment for your children's immunizations. I know Dr. Jetmore talked a little bit about that, and there was a little confusion over the immunization rates. The 90% is local health department rates. So across the state, the immunization rates from health departments are down 90%, and doctors' offices are down about 50%. So we really want to get those immunizations back up and going.
Okay. We will get back in touch with you then when you've got those dates, when you're ready to welcome the community into the facility. We will have you back, and we will talk about that.
Great. Thank you, Eric.
Thank you. Christine Stinson, Executive Director of the Wayne County Health Department. We'll be back with more In Focus in just a moment. I am very pleased to have a chance to spend a few minutes with the Reverend Dr. Jeff Carter, president of Bethany Theological Seminary. And Richmond has been searching for a while for an identity. There used to be the Rose City, and that kind of went away. I think we should be the college town. There are more colleges in this town, and one of them that I will say for a long time might have been overlooked or not thought about was Bethany Seminary. That has changed under your leadership, and I'm glad to see that.
Yeah, thanks, Eric.
Talk to me for a few minutes, if you can, about what the effects the pandemic has had on Bethany, its faculty, staff, and students. And for those who don't know, describe where Bethany is so people actually do know.
Yeah, and now if you drive by Bethany on Route 40 there on the corner of Earlham campus, you'll see a sign and a whole new front to our building. And in many ways, we emotionally reoriented our building so that we would face the community and put it in a parking lot. And why do you have a parking lot? Well, you expect people to come visit. We just celebrated our 25th anniversary here in Richmond, had a big party, a lot of community members through the door, and it was a wonderful celebration last fall with no clue what was going to arrive this spring with COVID. We've been there 25 years. As I said, we're on the corner of the Earlham campus next to College Avenue and Route 40. And we've got a neighborhood adjacent to the seminary building where many of our students that are residential live. So we've got a wider footprint than just that corner.
What was it like when this kind of hit and that student population that people don't always know about and associate with you all had to leave, go home? How did you all handle that?
Well, and since we're a small institution, there's 5 educational institutions in Richmond, Wayne County, and we're one of the smaller ones. We're able to be very nimble. And so I was actually traveling internationally and could watch the COVID response change quickly. And so as I got back to campus from a trip, we thought we had 2 or 3 weeks to make a transition, to move students, to move employees potentially to work at home and classes online. In reality, we had 5 days. And in a 5-day period, we outfitted everyone with the needed equipment to work from home. We moved things onto servers. We moved all of our classes that were residential to an online Zoom platform, much like we're communicating today. And within that short time, we were fully online as an institution working from home. It was a smooth and seamless transition. Where we differ from many institutions is that we did not send our students home. So our students that are residential, the majority of them stayed because they've made Richmond their home. They call this home, having moved from communities in Virginia and Pennsylvania and other places. And so we took our budget, our catering budget, and we partnered with a local food provider, Radford's, and we provided lunch for every student and family member in our neighborhood for every weekday of the spring term. So we wanted to, make sure that there was adequate food. We provided them with cleaning materials and then kind of a hedge of support and protection. So they're still, many of them still living here. Now, some of them graduated and we couldn't have a commencement ceremony, but for our local students, I donned my regalia, put on a mask, and my wife joined me as we gave party boxes that had cookies from a local bakery and their diploma and certificates and letters. And we delivered by hand to our students and celebrated with them. So it's been a very positive experience in that way, where we've found ways to maintain relationship and to keep folks here in Richmond their home.
The question for institutions, and because you're so small, you may have it worked out to continue with Zoom, but are you thinking about bringing people back into the building? What does that look like? What kind of time frame are you working under? Because you all are a pretty close-knit group of people.
We are close-knit. We like each other, and we work when we're together. Now, we're prioritizing the classroom, and so everything hinges on the classroom. We are going to be residential this fall, as most schools in this area will be residential with higher ed. We'll make some changes. We'll have what I call the golden rule, to do unto others as you would have them do unto you. And so we're going to wear masks, we're going to wash hands, we're going to social distance, and we're going to outfit all of our classrooms so that teaching can happen. Our professors have the freedom to teach as they're accustomed to, but that people will be safe. So one of the pieces that will change are the other programs that surround the classroom. So we'll have a limited workforce. We will not be having our typical meals together, what we call common meals, and worship will look different. We will not start out with worship, but we'll slowly build that as time goes on. I think one of the pieces that will really, that this impacts is our volunteerism. So for our students that are residential, they're part of what we call the Pillars and Pathways Residency Scholarship Program, where they live in the houses we've renovated around the seminary. They receive full tuition scholarship. They receive their housing for free, their books, a living stipend, And in exchange, they work for the seminary 12 hours a week, and then they volunteer in the community 2 hours a week. And our students have served in places, and like Girls Inc. at the community food banks, with the Historical Society and other Richmond nonprofits. And so right now, we feel like the classroom is secure and we can continue with teaching. So then how do we build in those other pieces so that our students can have a full experience? Because community is important as well as service. And we want our students to be able to serve the community in which they live, which is our community.
You mentioned starting off with not having worship, and the name is Bethany Theological Seminary. So I'm going to ask you, and this is not a political question, but being a school of theology, I need you to weigh in kind of on the social conversation that's been being held and has made its way to the courts as to how churches should be thought of when governors have shut them down, not allowed them to open with some other businesses. There's been the complaint that tattoo parlors could open, but churches couldn't open, that the number of people were limited, things of that nature. You're talking to religious people literally all around the world. Talk to me a little bit about how that conversation in your world has evolved.
Yeah, well, and the first is just a theological principle that the church is more than a building, it is people. And so the church has been meeting in many ways as we continue to do the good work, compassionate work through this COVID time, reaching out and helping neighbors and such. The issue of buildings and buildings being open, church people tend to be relational and they love to be together. And when they are together, there is often a lot of hugs and close conversations, as well as singing and sitting together in confined spaces, whether they be chairs or pews. And so at first, the decision was pretty easy to move worship online for safety's sake. Our students were used to using Zoom in the regular classroom before COVID. That's just part of our program. 3/4 of our students live at a distance, and so we use Zoom. And so our students who are now serving congregations easily moved to Zoom or other online platforms, and many of them, it was a seamless transition. The challenge, Eric, is when and how to return. You want to respect people's wish and for some right to gather, and yet there's so much that is not known about COVID-19. It seems to be developing right in front of our eyes. One blessing and yet complicating factor is that COVID-19 or coronavirus has not been as visible in Wayne County as it has been in large cities like Boston or New York. Therefore, I mean, there's a real rush to get back together. I'm hearing a different conversation with those serving churches in Washington, D.C. And I know churches with whom I have a relationship, there's been an enthusiastic return that's also accompanied a lot of planning and prevention. So the return has been staggered. Not all communities have returned. And what I appreciate the most is that the majority of communities are utilizing two of the gifts God has given us. One is good medicine, and the other is common sense. I think those are gifts that we all possess that are God-given, right? Good medicine and common sense. And I see so many church leaders using good medicine and common sense to balance then this yearning to be back as a community, and they're just making the right choices and moving slowly. But again, I go back to that original comment. The church is more than a building. It is a people. And the church is present each and every day doing the good works, as I would say, the kingdom, and getting together for worship is just an added blessing.
One of the other hats that you wear, besides president of Bethany, is that you're actually on the chamber board, and you are chairperson of the INA committee, the Issues and Advocacy Committee. That's a committee that probably started 2020 with an agenda of things that you wanted to talk about for the business community in and around Wayne County. But now with COVID and the challenges that it has heaped on the business community, employers as well as employees, How has that conversation, how has that agenda changed, and what is that committee talking about advocating for as we get to the back half of the year? And you know, this time of year, businesses start talking about the holiday season, which is incredibly important, particularly for retail, and nobody knows what that looks like. Talk a little bit about what you all hope to be able to push and talk about with the community.
So when you gave me a bit of a tickler to say what are the top 5, and I just want to share at the beginning of my term, the top 5. One is we wanted to take advantage of the I-70 corridor and think of ways in which we might strengthen some revenue resourcing. We wanted to talk about being a knowledge town, that there are 5 educational institutions right here in Richmond, Wayne County. We wanted to talk about quality of place and what makes Richmond, Wayne County, such a great place to live. Wanted to talk about housing stock. Wanted to talk about internet and how do we get internet to the rural communities. So those were the top 5. So number 6 was groups working together, a spirit of collaboration within the community. And that was number 6. And now that's number 1. I have to say I am incredibly proud to be part of this community for what I have witnessed in just these last weeks. We have really come together. A number of community leaders have stepped forward to bring larger communities together to think about not opening our economy, but recovering our economy. 2 very different things. You can put an open sign up, but to say that we're going to recover as one community, I think is a large and difficult task, and we are making incredible headway. So the number 1 thing that Issues and Advocacy is working on right now is working together, different groups, different constituent groups, working collaboratively for the recovery of this community. And when I say thinking systemically and collaboratively, if you hear the number of different communities that are being pulled together for recovery, it includes large business and manufacturing, small business and kind of Main Street, the nonprofits, education, healthcare, our civic assets and creative arts, and then our at-risk folks. And so if you hold all of those different communities together, working together to the common goal of recovery, I believe that Richmond and Wayne County will be even stronger in a post-COVID-19 world than it was when we entered a post-COVID-19. And that has to do with a lot of wonderful people stepping forward for the good of this community.
Right. Jeff Carter, president of Bethany Theological Seminary. I always appreciate the time to be able to talk with you. I don't get to see you as much as I would like. But I hope that you stay safe. You and the entire Bethany family, please stay safe, and I hope to see you again soon.
Yeah, thanks, Eric. Thanks for this opportunity. It's always great to talk to you, and it's always good to talk about Richmond, Wayne County. So thanks.
Thanks for the time.